The other thing is, I've learned this over and over again, always give people choices of what to do. If you tell them this is what you have to do or else, your chances of them doing it go down enormously. But if you say you can do A, B, or C, pick the one that makes sense and will help you get to your goal. That's a very powerful tool, and that's what people like.
Thank you. Very, very insightful answer, and also valuable the answer. So back to the interview for the so today's interview is focused on the newcomer founders, the beginner founders. So in the startup industry, we the problems that we face, among the problems, the big problem that we face is finding co-founders. So and also in healthcare industry, finding a co-founder, it's not very much different, but it has particular special needs to be a healthcare co-founder. What are your advice and opinions on like finding founding a team, finding a co-founder in today's healthcare industry?
It's a great question, and in my experience, a team and co-founders, there has to be a fit mentally. It's not the thing you're doing, it's whether there's a synergy between you and another person. And one thing I learned from my time in the entertainment business, because when I was young, I was younger than you. I was in the entertainment field, in the rock and roll field. And I used to produce records and put on rock and roll shows in Philadelphia and New York. And I learned something very valuable. I don't care what you tell me you can do. I put you on stage, let you play, and I watch the audience. And if the audience is going like this, I know you can do it. And if they're sitting still, I know we got a problem. So the one thing is, it's an empirical question. Can they play? And can they do it for the audience that is the target? The second thing I learned is what a professor at the University of Michigan said to me one day when I went for a job interview. He said, trust your gut, never trust your head, because your gut doesn't lie and your head does. And so when you're talking to somebody and your gut is going like this, it's probably not going to work. And if it's real calm, and you may try it, because that says there may be that synergy. So that's the key. There's no easy formula. It's trial and error. You will do it and you will fail. People are different. Some people have different views of what they expect to get out of it. The people who have joined my team are all aware that the payoff comes in the future. They get ownership. They earn it piece by piece, so that as they succeed in doing things, their ownership begins to increase. What I didn't do, and I would never do, if somebody says, well, I'll come in and be your co-founder for 10% of the company, that doesn't work. If you want to get 10%, you have to earn the 10%. Okay? So that's the advice I'd give, is trust your gut, see if the person can perform, and have them earn their way to the ownership and the rewards that you want to give them, so that you're confident that what they're going to do is produce, and you have to produce too.
Thank you. Yeah, it really clarifies how the founders should recruit the team and the newcomers. It really simplifies it. It's amazing that you answer it that way.
Yeah. Let me add one more thing. It's important when you're talking to somebody as a potential collaborator, co-founder, team member, that you need to be authentic yourself. You have to speak from the heart, because that is what you're communicating, and you want to see if they speak from the heart, because that's where you begin getting the synergy together.
Great. Yeah, thank you. So yeah, so for the next step, if the founders can get their team and to grow their business, their venture, to related to this, what business stage is your venture is right now, and what is your business growing, and how do you play for the growth of your business?
That's a wonderful question.
What are you doing further? Yeah.
We still have to build the minimum viable product to get it out to the target customers. Part of that is because I learned in the software field in the 80s and 90s, I saw many companies who put out an early product that had problems, and many of them never succeeded. They died because when users began using something that had problems, they said, I don't want to touch this anymore. So one thing is, make sure that when you're ready to launch whatever it is you're doing, that it's reasonably good, that it reflects what the customer would like to do, and that you tell the customer up front, it's not perfect, but we can improve it. And that's why in the software field, we talk about the beta version, right? We talk about alpha, beta, incremental. All good software companies learn from each successive time they introduce something, but they never introduce bad stuff, because that's the kiss of death. So we're still building an MVP because I haven't been satisfied that the people doing the design were communicating with the customer target base at the level the customer would be really happy to participate.
I see. Thank you. And also, what advice would you give the founders, the new founders in the healthcare industry? Like they're coming to found a new startup. When they're trying to launch a new product. What advice would you give regarding to your experience?
I think that's a tough question, because healthcare covers so many things, and most of it's focused on disease. And then the people in the field talk about well-being and wellness. I created the field of wellness genetics. I started using the term in the late 90s when I realized that the Human Genome Project had been completed and we could look at everyone's genes beyond disease. So if you're in healthcare, you may be doing something in a device area or working on some new pharmaceutical. That means that they're going to be heavily regulated. So in the United States, you have to go through the Food and Drug Administration. In Europe, they have their regulatory process too. So in healthcare, a lot of the challenge is that whatever you do is going to be regulated by some government agency somewhere in the world. That means that the time to market is very long and the financial requirements are very high. So if you're doing something, for example, where you want a virtual system so that a physician can talk to a patient while the patient is driving their car, that may be easier to do. And so if you're in the healthcare field, you have your choice of what technologies to pick and what problem to solve. The more the problem is related to solving a disease, diagnosing a disease, treating a disease, or preventing a disease, the more likely you are that you have huge regulatory hurdles. If you're talking about lifestyle, changing nutrition, impacting their behavior, how they sleep at night, whatever you want, that doesn't have the same regulatory process. There's still the market issue. Is someone willing to buy it? but it's two different sectors between the regulatory sector and the unregulated sector. Does that help you?
Yeah, yeah. Due to an answer, it's an intensive process to start a healthcare start a business in the healthcare industry, and
Yeah.
we have case studies like billion-dollar case studies like Theranos. They have gone pretty wild and down the issues right now. So yeah, it's really an intensive process, I guess. So
It is, but
I,
but Theranos was a scam, so they could have done better. But but yeah, there's a lot of money that's been lost in the healthcare field because the problems were too complex to solve.
and also like in countries like here, people the general public doesn't have much full knowledge of what the healthcare, or like even to take care of ourselves. We don't have enough knowledge, the full knowledge of the healthcare, and it's really easy to like get scammed or like things like that. So yeah, and also thank you for answering all the questions. Would you if and also we have the 30 minutes time frame. So what if you condense if you concentrate your experience through your journey, what advices would you give to the new startup founders without the limit of the healthcare industry, to all startup founders? What advices would you give?
Well, it's easy to give advice, but I'll share the one thing that has guided me in the choices I've made of what to do. If you ask me to do something, I only ask myself one question: why not? And if I can't answer that, I will say yes. And so that's the best guidance I could give. If someone says to someone, why don't we start a company to do X? If they say, why shouldn't I do that? If they can answer that, don't do it. But if they say, I don't have an answer to why not, then go ahead and do it. Now, that doesn't mean it'll work, but at least you're going into something with at least a clear mind that it's something okay to try.
Thank you, sir. It's very valuable.
And by the way, I'll offer, you'll obviously post my email address. I'm happy to, if anyone wants to communicate with me, I'm happy to share more, because, the more open our systems are, the more open we are about learning from each other, the more powerful we can build solutions in healthcare.
Yep, I'll put your links in the video descriptions too. Yeah. So yeah. So let's stop the interview session, and also thank you very much, and it's an honor to host an interview to you, sir. Yeah.
Thank you much, and I appreciate the opportunity. You guys have a wonderful evening, or whatever part of the world you are in. Have a great day.
Yeah, you too, sir. Yeah. Good.
Right.
Stop the recording.